Good afternoon, my dear listeners. The topic of our day today is OTC medicines and responsible self-treatment. As we remember, in previous videos we have already discussed the classification of medicine. Today we'll stop more detail on the place of OTC drugs in the international practice and requirement to OTC drug. In the United Kingdom, under Medicine Act 1968, most medicine can only be sold or supplied at pharmacy under supervision of a pharmacist. However, some medicine, general sale list medicine, can be sold at other premises, such as supermarkets, as long as they are pre-packed and the premises can be closed to exclude the public. In the United States, the same approach as in the United Kingdom, and new approaches on introduction of third category by a number of names including pharmacist legend, pharmacist only third class of drugs, and behind-the-counter B2C drug, similar to over-the-counter OTC status. B2C would allow a patient to access medication at pharmacy without seeing a doctor. But B2C would allow a patient to access drugs after an assessment and decision by a pharmacist. In Italy, is the same approach as in the Commonwealth of Independent States, CIS countries. The drugs are divided into prescription drugs and non-prescription drugs. General sale list medicines that present in majority of European countries can be sold by a wide range of shops such as newsagents, supermarkets and petrol stations. Often only a small pack size or low strength of the medicine may be sold in this way. For example, the largest pack size of paracetamol that shops can sell is 16 tablets. But pharmacies can sell a pack of 32 tablets. The highest strength of ibuprofen tablets that shop can sell is 200 milligrams, but pharmacies can sell tablets at 400 milligram strength. The main criteria for assigning a drug to the category is according to the safety for human health. Only pharmacies may sell this medicine, and a pharmacist must make or supervise the sale of medicines. Some medicine are reclassified from prescription only to pharmacy only, from pharmacy only to general sale list. This may happen after several years when it's known that the medicine is safe for most people to use. For example, acyclovir cream used to treat cold sores was first available as the prescription only medicine. After a few years, it was reclassified as a pharmacy medicine, and later it was reclassified again to general sale list. Over-the-counter drugs are medicine that may be sold directly to a consumer without a prescription of the healthcare professional, as compared to prescription drug, which may be sold only to consumers possessing a valid prescription. In many countries, OTC drugs are selected by a regulatory agency to ensure that they are ingredients that are safe and effective when used without a physician care. OTC drugs are used in relieving symptoms of commonly occurring ailments such as body ache and fever. Some OTC medicines relieve headache, body pain and itching, while some drugs help manage recurrent problems like migraines and allergies. These can either be recommended by a pharmacist or requested, purchased by a customer independently. Responsible self-medication based on the development of OTC drug market and requires that medicine used are of proven safety, quality and efficacy. Drug or its ingredients have not direct or indirect harms. Should be used only to outpatient. Doesn't contain any substances, activity or side effect that require further study. Easy to use and well known in the market. Medicines used are those indicated for conditions that are self-recognizable and for some chronic or recurrent condition. In all cases, the medicine should be specially designed for the purpose and will require appropriate dose and dosage form. The importance of healthcare and self-medication has been increasing during last decade. The role of the pharmacist has been changing in the condition of self-medication development. For pharmacists, their greater involvement in self-care means greater responsibility towards their customers and increased need for accountability. The increase in self-care is due to a number of factors. These factors are socio-economic factors, lifestyle, ready access to drugs, the increased potential to manage certain illness through self-care, public health and environment factors, greater availability of medicinal products, and demographic and epidemical factors. OTC drugs group used nowadays are antacid and acid reducers, antiemetic, antidiarrheal medicine, antihistamine, dehistan, cough medicine, herbal products and supplements, laxatives, pain reliefs, condoms and other contraceptive devices, contact lenses solution, antihemorrhoids, smoking cessation aids, cosmetics, perfume and skin treating creams and lotions, antiseptic, mouthwashes, etc., soap, toothpaste, vitamins taken to improve overall health, sleep aids, fiber and dietary supplement, and many others. Non-prescription medicine market as usually has the following goals: fast and effective relief of symptoms of diseases that do not require medical advice, the possibility of patients to self-help relieve minor symptoms which will reduce the burden on the medical service, increasing the availability of medical care to the population living in remote regions. OTC drugs are dignified by the Government Regulatory Association to be inoffensive for the self-medication. Self-medication is a treatment of common health problems with medicine especially designed and labeled for use without medical supervision and approved as safe and effective for such use. Self-medication means treating ourselves for temporary or minor health problems such as colds, heartburn, allergies, and headache. In the 8th on 17th, World Health Organization proclaimed the concept of responsible self-treatment and identified it as a consumer's use of drug to eliminate violation and symptoms it can recognize on him/her own. Many healthcare organizations have made important statements on self-care and self-treatment. The World Health Organization underlined guidelines for regulatory assessment of medical products for use in self-medication in the beginning of this century that improvements in people's general knowledge, level of education, and social economical status in many countries form a reasonable basis for successful self-medication. Self-medication has an important place in the healthcare system nowadays. Recognition of the responsibility of individuals for their own health and awareness that professional care for minor ailments is often unnecessary has been contributed. Thus, self-medication is the use of non-prescription medicine by people on their own initiative. Pharmacists have a key role to play in providing them with assistance, advice and information about medicine available for self-medications. The term responsible self-medication is often used to emphasize the appropriate use of OTC medicine by informed patients and consumers with healthcare professional support where necessary. Pharmacists and the manufacturers of non-prescription medicine share the common goals of providing high-quality service to the public and encouraging the responsible use of medicine. That is written in joint statement by the International Pharmaceutical Federation and the World Self-Medication Industry 1999. Within the framework of the concept of responsible self-medication was carried out the term pharmaceutical care, that means acceptance by the pharmacist of responsibility to a particular patient for the outcome of treatments of the drug. Pharmaceutical care is a complex program of interaction between the pharmaceutical professional and the patient throughout the entire period of pharmacotherapy. Thus, the precondition for responsible self-medication development are aging of population, expanding the range of healthcare services and their appreciation, improving the quality of life of the people, improving the level of education, promotion of healthy lifestyle, preventive measures, OTC market development. In most countries, patients and consumers are able to have direct access to OTC products for many conditions such as acne, allergic conjunctivitis, arthritis pain, caries prevention, cold sores, cough, diarrhea, fever, flu prevention and treatment, headache, etc., mouth ulcers, nausea, sore throat, etc. Responsible self-medication can help to prevent and treat symptoms and ailments that do not require a doctor, reduce the pressure on medical services where healthcare personnel are insufficient, increase the availability of healthcare to population living in rural or remote areas, enable patients to control their own chronic conditions. These benefits translate into patient and consumer wellness and productivity, economic gain for employers, and cost saving to healthcare budgets through reduced medicine budget cost and reduced physician visits. The main condition of realization of responsible medication are the presence of the approved list of OTC drug, a high level of development of the market of OTC drug, the ability of certain self-diagnosis, and availability of pharmaceutical care by a pharmacist. Thus, OTC products are an important element of self-care. Due to greater availability of such products and increasing interest in self-care, use of OTC drugs is also increasing. Dispensing OTC drugs through pharmacy, pharmacists should give the information who going to provide self-medication following advices. Before taking or using the medicine, read the instruction leaflet, check the expiry date, store the medicine in a cool place protected from light and moisture, keep out of reach of children, consult your doctor if the medicine are for elderly, pregnant women or children. Before purchasing a drug, ask your pharmacist or other healthcare professional for advice. And do not take the medicine for longer than the period indicated on the instruction leaflet. Pharmacists are increasingly recognized as key players in the healthcare delivery. Providing information about the minor illness, treatment and the selection of OTC products are now recognized as critical duties for the pharmacists around the world. Pharmacy organizations have established practice guidelines for pharmacists when dealing with self-medication. The International Pharmaceutical Federation states several principles for pharmacists when offering professional care to patients in the self-care area. The statement of principle are follows. Pharmacists have a professional responsibility to provide sound, unbiased advice and to assure that self-medication is resorted to only when it is safe and appropriate to do so. Thank you for your attention. We'll be glad to see you next video.